Okay, today we're going to talk about plantar fasciitis and the soleus pump, or the sural pump, which you may not have ever heard of. So, when we're walking, there is a certain gait pattern, and what it is you have what we call heel strike. You roll off the outside of the foot and then back across and push off of your big toe, and that's called the gait pattern. And when you're running, you're doing that over and over again. And what can happen, the fascia that goes from the bottom of the foot all the way back up to the top of your head, it's a fibrous type material, but it can get knots or adhesions inside that fascia so that the muscles aren't sliding over each other, the fibers aren't sliding over each other like they're supposed to. And so you get these adhesions, which is kind of like glue in there where it won't let the fibers move. And so that can get inflamed. The fascia is that membranous little extension from the bottom of your foot all the way top of your head. And itis is inflammation, so fascia-itis, fascia inflammation. So what we can do with the fascia itself is we use something called active release technique, and it's a soft tissue technique where you take a muscle from the shortened position to the lengthened position underneath a thumb contact or a finger contact, but kind of determined by where the particular issue is. But this is not the most comfortable treatment, I have to say, for fasciitis, because a lot of times, because of that heel strike and the rolling and the push off with the big toe, the tendon for the big toe, because you keep pushing off, especially if you run a lot, like I said, for the runners out there, it can get a lot of adhesions. And when you work on it, you bend the toe, you contact that tendon, and then you straighten the toe out, and you can feel it's kind of a crunching knot in there on that tendon, which does not feel good when you try to break it up, but it does break that up, which allows the tendon to move better, and the tendon runs through the tendon sheath that is that fascia. And so you kind of help break it up so that you don't have the irritation, don't get the inflammation. And so that's going to help a lot with fasciitis. But there's also a stretch you can do, and what that does is it stretches that soleus pump, or the soleus muscle, which contains the soleus pump, which helps take deoxygenated blood back up to the heart. This also is good for people that have edema or swelling in the lower leg, because you can do that stretch. It'll help the pump to work better and to get some of the fluid back up to the heart to help that circulation. So the soleus stretch, and the soleus is just, they call it deep to the calf muscle or the gastrocnemius, and so it's just below that muscle, and it's kind of shaped like a V, so it goes down here, Achilles tendon, and then goes up to the top of the calf, right where it attaches to the knee joint itself. And so what you do is you stand in front of a wall, put your big toe, or the ball of your foot actually, on the wall with your heel on the floor, and then you lean forward and try to get your knee out over the toe. Okay, so you bend the knee, try to get the knee out over the toe, and you'll notice that it's easier to do that. Well, you can do it more on one side than the other, I should say. And so the one where you can't do it as well, that's the one you have to practice on, and you don't bounce up and down or anything like that. You just lean forward and feel the stretch, and make sure you're doing both sides. Even if you only have pain on one, you can always do better and improve both sides. That will also not be the most comfortable thing, but you have to stretch, or everything's going to tighten up and not move the way it's supposed to. So you do that stretch. You can do it for 5 minutes at a time, 3 minutes at a time. Do that 3 or 4 times a day. That's going to ensure that you have the best circulation from the lower leg back up to the heart. The muscle fibers are moving the way they're supposed to. That's going to help that, along with the soft tissue work on the bottom of the foot, on the fascia, and that's going to make sure that you can actually keep running without having that pain and the fire on the bottom of your foot. Now, there's also something in the front of the leg when it feels like you have shin splints, for all the runners out there. So you have something called the interosseous membrane between the tibia in the lower leg, which is the weight-bearing bone, and the fibula on the outside of the leg, which just acts as a place for the muscles to attach. And in between those two, you have that interosseous ligament. Now, to help relax that, you can take a massage gun. They have those little massage guns, and run it just outside of your tibia. You can feel that shin bone, and run it between those two bones, and that's going to help relax that interosseous ligament that allows the fibula and the tibia to slide over each other a little bit better. And the fibula, because the tibia is not going anywhere because it's holding your body weight up, but the fibula, it's going to allow it to move a little easier, and that's going to help prevent those shin splints. If you do get shin splints, you can also put ice on there, excuse me, and that's going to help reduce the inflammation. But using that massage gun on the interosseous ligament itself is going to help relieve those shin splints, which is really going to help, once again, if you're a runner, marathon runner, just everyday kind of going out for even for a walk, to make sure that the biomechanics of the leg are working the way they're supposed to help relieve those symptoms. Now, if you have a question or concerns about your shin splints or your plantar fasciitis or even the soleus pump, consult a chiropractor in your area. Sometimes physical therapists can also help with this as well. And ask them if they have any sort of certification or experience in dealing with those issues. And obviously, if they don't, then you can ask them if they can refer you to someone that does. Or if they do, then you'll know they're the ones for you. Try it out. If it doesn't work for you, then you can find another chiropractor that might have a different technique, or it just might be more effective. So those are the solutions to treating shin splints, plantar fasciitis, and making sure you're getting that circulation back up from the lower leg up to the heart. As I said before, consult a chiropractor in your area to see if they can help you with those issues.